Hello and welcome to the Byline, where we talk about the strategies and technologies that are transforming business finance management. I'm Chris, and in today's episode, I'll be discussing one of the most persistent administrative challenges in the healthcare industry: the accounts payable process. If you're in healthcare finance, you know the drill. You're managing countless suppliers, from critical medical equipment and pharmaceuticals to everyday operational services, and you're doing it across multiple departments, clinics, or even hospital campuses. The paperwork is relentless, the approval chains are long and winding, and the risk of a simple mistake leading to a late payment or a compliance issue is always looming. This manual paper shuffling is a liability. So, today, we're going to talk about the solution: AP automation. We'll explore why it's become an essential technology for any healthcare organization looking to scale efficiently and securely. So let's start by really diagnosing the problem. What is the true cost of not automating your accounts payable? It comes down to four critical areas. First, and most obviously, there are the direct operational costs. Industry studies show that the cost to manually process a single invoice can be shockingly high when you factor in all the labor for data entry, printing, mailing, and physical storage. It's a classic example of a low value, high effort task that consumes your finance team's precious time they could be spending on financial forecasting or budget analysis. And with that manual effort comes the high probability of human error. An incorrectly coded invoice or a duplicate payment can easily slip through the cracks. These mistakes add up to real dollars lost. This brings me to the second major pain point: a complete lack of spend visibility and control. Imagine you're the CFO of a growing network of urgent care clinics. One of your clinic managers is consistently overspending on office supplies from a non-preferred vendor. Without a centralized system, how would you even know? You'd likely only find out weeks or months later when the numbers don't add up. Manual AP creates data silos. You have no real-time insight into who is spending what, which makes effective budgeting and financial strategy nearly impossible. The third issue is the strain this puts on your vendor relationships. In healthcare, your suppliers are more than just vendors. They are partners in patient care. The timely delivery of medical supplies can literally be a matter of life and death. When a manual AP process creates bottlenecks and causes payments to be late, you're damaging that critical relationship. You lose credibility, you lose negotiating leverage for better terms, and you risk disrupting your entire supply chain. And finally, there's the elephant in the room for any healthcare business: compliance. The industry is governed by strict regulations like HIPAA, which dictates how patient and partner data must be handled. A filing cabinet full of paper invoices containing sensitive vendor information is a massive compliance risk. Automation creates a secure, digital environment with an unchangeable audit trail for every single transaction. Okay, so we've established that manual AP is a significant problem. So, what does the cure, a modern AP automation platform, actually look like? What are the core components you should be looking for? It all begins with intelligent invoice capture. The system should be able to receive an invoice in any format: email, PDF, even a photo from your phone, to automatically read and extract all the key information. The invoice number, the amount, and the vendor details should all be captured instantly and accurately. No more manual keying. From there, the platform needs to manage your approval workflows. This has to be highly customizable. A $50,000 equipment purchase for a surgical department should have a very different approval chain than a $500 office supply order for a dental clinic. The system should allow you to build these rules so invoices are automatically routed to the correct people. And because your approvers are busy professionals, the ability to review and approve an invoice from a mobile device is absolutely essential. Next is centralized management of vendors and payments. Juggling hundreds of vendors is a nightmare. A great AP platform centralizes all vendor data, contracts, and communication. But the truly game-changing feature here is consolidated billing. Imagine if, instead of receiving hundreds of individual invoices each month, you receive just one single bill that covers everything. Your team reconciles it, and with one click, you can pay every single one of your vendors. This simplifies the process immensely. And of course, all of this needs to talk to your main financial system. Seamless integration with your ERP or accounting software, whether it's NetSuite, QuickBooks, or Sage Intacct, is non-negotiable. This ensures data flows between systems automatically. And that's exactly what Order.co does. It's built for healthcare organizations that need to manage hundreds of vendors and invoices efficiently. With Order.co, you can automate every step, from purchase approvals and vendor management to consolidated billing, while maintaining complete control and compliance. The system integrates seamlessly with your existing ERP, centralizing every transaction into a single, auditable workflow. For healthcare teams juggling multiple locations and multi-supplier networks, it's the simplest way to stay compliant and on budget. So, how do you make this transition? Implementation doesn't have to be a huge disruptive project. I'll give you a 4-step process instead. First, you have to assess and map your current AP workflow. Get your team in a room and walk through every single step, from invoice receipt to payment. Where do things get stuck? How long does an approval typically take? Second, choose the right technology partner. And for healthcare, this is critical. You need a vendor-agnostic platform. Many healthcare providers rely on a wide range of small, specialized suppliers. You need a system that can work with 100% of your vendors, not just a select few that are part of a pre-built network. Third, focus on integration. This is a technical step, but your chosen partner should make it easy. Connecting the AP platform to your accounting system is what creates that seamless flow of data we talked about. It's what eliminates duplicate entry and ensures your books are always accurate. And finally, and perhaps most importantly, is training and adoption. You can have the best technology in the world, but if your team doesn't use it, it's worthless. A good platform should be intuitive and user-friendly. Your training should focus on the benefits for each user. Less paperwork for the AP team, faster approvals for managers. When people see how it makes their jobs easier, adoption will follow naturally. Let's recap what we've covered. Manual accounts payable in healthcare is a source of high costs, critical errors, poor visibility, and significant compliance risk. The solution is an intelligent AP automation platform that provides automated invoice capture, customizable workflows, centralized vendor management, and seamless ERP integration. And implementing it is a clear 4-step process. Assess, choose a partner, integrate, and train. Ultimately, automating your AP allows your organization to focus on its core mission, providing excellent patient care. A platform like Order.co is built to bring this entire procure-to-pay process together, from purchasing and approvals to payments and reconciliation, all in one place. It gives healthcare leaders the control and visibility they need to scale, with compliance built into every step. Thanks for listening to this episode of The Byline. Be sure to follow the podcast and join me next time for more strategies and tips on how to practice efficient finance management. Enjoy the rest of your day.